Okay, so anterior, you're gonna have the handle parallel. And we don't want it up like this because we don't have a tooth that's protruded, right?
Okay.
So we're gonna lower that handle so that it's parallel to the way that that tooth is going in, but it also makes your face close to the actual tooth surface,
Okay.
okay? So that means the face is not at that 0 to 40, but when I lower it, it's 0 to 40 degrees before I insert. Okay, so then I'm going to pivot in. Okay, so if you hold it up, can you see where it's actually, because you guys have the clear gingiva, so you can see where I'm inserted. And I can assess around. Okay, if I say bite, because I'm just acting like I have subgingival deposits. If I say bite, I'm going to get underneath it. Okay, underneath the deposit to cup it, lock the toe. So see how I rotate it towards the direction I'm going?
Okay.
So this is my rotation to lock it.
Okay.
Open it up to angulate it. That's where I create the angulation. That's 70 to 80 degrees. Okay, that's angulating. I need to increase pressure, meaning I'm going to squeeze between these two fingers. Squeeze it.
Okay.
That's my calculus removal stroke.
Okay.
Okay? Now I'm going to close it back so that my cutting edge is not against the gingiva. Now I have that smooth back again. I can assess around. Let's say bite again. I'm going to get underneath it, lock the toe, angulate, increase pressure, lift up again.
Okay.
Close it back, assess back around. And I can come out.
So when you're doing the anterior, do you flip between going towards and away, or can you just stay like that?
You're gonna flip ends.
Okay.
And you gotta flip ends because if I do this, I can't go subgingival.
Okay.
To go back towards me.
Towards the other.
Correct.
Okay.
I'll be into it. So that means I gotta flip ends to come this way for it to be adapted properly with my cutting edges.
Okay.
Mm-hmm.
So we do toward then away.
Or you can do away. Her that one thing you gotta have that smooth back. Wherever you're at, the back has to be what's inserting. You don't want to force it, right? You want to be able to, when you're inserting, it's a smooth insertion. But I can force it, and it hits the gingiva. But this back should just be a smooth insertion, so I'm pivoting. Just like you guys have done with the Explorer. Think about it like with the Explorer, that I'm actually just as smoothly and gently doing it.
But then the toe will be scraping my tooth.
So it's scraping the tooth. That means that your face is not against the tooth surface as close as it can be. So think about the palm of my hand is my face, right? And I actually, when I go to, if you think about putting your hand in your pocket, if your hand is open, I can't put this hand in my pocket except backwards. I've got to put my hand, the palm of my hand as close as I can to slide it inside the pocket. That's what you're doing here. It's the palm of my hand that's close to the tooth surface. Gotta have it as close as I can in order for it to go subgingival.
Yeah, you do it so smoothly that the tip, this tip over here,
I haven't always done that though.
Doesn't scratch, not even a bit. For me, it's like scratching.
Okay, then you guys have a little bit too much pressure too.
Okay.
So the pressure only comes when it's time for me to remove. So when I'm doing anterior, so watch your face there. If I have it up, that means, and remember anterior we need parallel. Posterior is close as possible to parallel. So for anterior, if I have this up, that means I've got a buck tooth. I always try to relate it to that. If you don't see a buck tooth in the front, then my instrument handle shouldn't be up like this. Anterior, I want to lower it so that my face is as close as possible to the actual tooth. So when I insert, the back of this is against the gingiva. So that's what's making it smooth. I insert smoothly. See that? And I also should here. I should hear that.
I can't promise this for now.
So, first thing is relax your nerves and stuff. So when you go in, it's a smooth insertion. And if you hit it like, oh, Mr. Lulu, I'm so sorry. You didn't hit it. So smooth insertion, and I'm going. The good thing is you guys have the clear gingiva. And when I was in school, it was solid pink. I couldn't see anything, and I was just praying. My teacher didn't hear anything. So I'm like, when I was going in, I would be doing things like tapping my foot. So it's like, she didn't hear anything, you know. And she's, why do you always tap during the evaluations? Never said a word. I didn't cheat, you know, but it was more so they couldn't hear, because I know that I was doing that. Okay, had a little bit too much pressure, but you have to lower the face as close as you can. So when you're going in, I'm going around. You guys can see. So when I get underneath, if I locate a deposit, if I say bite, get underneath it. Okay. Then the next thing is going to be to lock the toe. You're locking the toe in the direction that the toe is facing. So I'm going to lock the toe, angulate. Now when I increase pressure, I'm going to squeeze here. Squeeze, and then lift off. Okay? Now I need to close it back. Because if you leave it open and you start going, the cutting edge is against the gingiva. So I got to close it back, assess around. If I find another deposit, okay, get underneath it first, because if you stay on top, it'll burnish the deposit, meaning that it slides over it, and you just smoothen the deposit down. But you got to get underneath it, okay, lock the toe, angulate, lift it off again. And it's almost like you're lifting off, like if you see bark on a tree, I just need to lift off like pieces of the bark. I try to give visual things, because I can imagine a piece of bark that comes off. So think about it like that. A little bit differently. Whereas if I'm going mesial, this one, I need to make sure that it's close as possible. So see, my handle doesn't necessarily go parallel like this. It's going to be occlusal plane. So that means my face, but take a look and see where your face is at in relationship to the tooth. So when I do that, it's inserting smoothly, because my back needs to be against that gingiva. So I'm in, and then reposition, and then I can come around. Okay? Y'all look like Miss Martin. What y'all thinking?
Can you access the distal of that too?
I can.
Okay.
Distal's different, where that face can actually touch it.
Mm.
So distal, you can touch it, go subgingival here, and then reposition. Distal, I feel like it's easier, but I thought somebody told me last week, oh, this distal's hard. Distal to me is easier, because I can actually adapt it against it, insert it, and then reposition easier.
I feel like I'm pulling the gingiva a lot when I just.
Well, you probably are in the
straighten
beginning, just like when you guys did the Explorers. It was kind of rough, and now that you're on the student partner, it's not as rough, because you've kind of gotten used to it.
Mm.
So you probably are a little bit rough, but he didn't tell anybody.
Yeah. So when you angulate, when you scoop the calculus, okay. So locking it means like just
Lock
like,
means that I'm taking that toe third, and I'm actually rotating to lock it to where my instrument won't slide. When I scoop it, it prevents it from sliding off the tooth. That's how I know that you haven't locked it. When you go to perform a calculus removal stroke and you slide off the tooth, you didn't lock your toe.
if the calculus slides off.
If your instrument slides off. If your instrument slides, you forgot to lock. That's the step you've missed. When you perform a calculus removal stroke and the whole instrument, like we call that flying. It flies off the tooth, you forgot to lock it.
That makes sense.
Because it has nothing to hold on to. You've got to lock it, or it's going to slide right off.
Okay, so we lock it by the toe.
Toe has to be locked. Here, it's going to be scooped out. Then dipper, you're going to scoop out that way. Never want to scoop into the gingiva. Okay.
Okay.
Any other particular questions?
Is this mine?
I think those are yours.
This is mine.
The angles. So when you're doing, of course, is everybody feeling good about selecting correct working in? Because it's similar to your universals. Everybody good on that? Okay. So selecting correct working in, I'll show you on facials here, anterior or cross. So if you got anterior or cross, that's going to be your correct working in. I'm going to show you incorrect. So I'm going same direction. I can't insert that. That's an incorrect working in for that same away position. Okay? Any questions about that?
When you do towards, does it still go across the two?
That is correct. So if I did, I'm just going to turn it so you can see this is the correct for towards. Okay? And I flip the ends. That would be incorrect. Okay? How's everybody on that? Feeling good about it? And it'd be the same thing for our linguals, right? Anterior cross for linguals. You ask them to lean in and look. And make sure your handle's parallel anytime you're working on interiors. And if it's flipped out, then of course you're going to know that it's incorrect. Everybody good on that? Okay. So on these mandibular anteriors, I'm going to do an away. Tell me if I have the correct working in. Okay, I'm going to flip ends. Now tell me if I have the correct working in.
It's hard to see, isn't it? Do it one more time.
Remember, anterior cross. Okay, Miss Brady said yes. Anybody else?
Can you flip
I think
ends
Miss
again?
Crawford said yes.
Let's flip ends one more time. Oh yeah, that's
No.
wrong. It's the other way.
Anybody else said this is incorrect? Okay, Miss Schultz said incorrect. Okay. All right, so this is the correct working in here. So once we find the correct working in, we want our actual face here to get as close as we can to the tooth, and then make sure our handle is parallel with the way that that tooth grows in. So I'm retracting the tongue. I'm going to get a little bit more light. Okay, so face here is close. I have it in the midline. So now I've got my 0 to 40 degree adaptation for insertion. So when I insert, I'm going to pivot in and go around. So notice when I had it close here, smooth insertion with the back. Everybody see that? Smooth insertion. Pivot in. Go around. If I say bite, get underneath it. Roll to lock the toe. Angulate. I need to increase pressure. Try that again. Insert. Got a deposit. Underneath. Roll. Angulate. Small bite, close it back. Let's say bite again, underneath, roll, angulate, close it back, and go around. How is that with inserting? For those that had difficulty with insertion, what did I do different that you have been doing? Tell me about it, Ms. Schultz. What do you feel is different?
I didn't have it straight up like this.
Your handle? Your handle was over this way?
Mm-hmm.
So So that's gonna get you every time, because what happens is your cutting edge ends up against your patient's gingiva. So when we go down, it's gonna cut them. So handle, so she's found her correction. What about Miss Brady? Was this your area too?
I've.
Oh, Miss Canis.
Angulation.
So when you're inserting, what was your correction that you saw that I did, different from you?
I guess you like a bit of into it.
So you were forcing it?
Mm-hmm.
Okay. So she's found her correction. Who else had this? Miss Marie, was that yours?
Me, I had problem with insertion. No, it's getting better when, yeah. I just all
Is
my
it just your
problem was
face?
trying to just hug all of the, distal
Posterior?
or posterior of the tooth, which is I shouldn't like hug the tooth like 100%.
On the distal it will, for posterior.
For distal.
Yeah, unless you've got some crowding and that you don't have the ability for it to hug, it's gonna hug your distal and go in.
Just for distal, but for mesial.
It won't
So
hug.
that's what I was trying to do.
Mhm.
Trying to, adapt it.
Yeah, mesial it will not. Just for the distal, you'll have the hugging and it slides right in.
Okay.
But for those difficult to interior, did that help you, Miss Soto? Okay. Did you find your correction? Okay. How can you correct yours? What do you think you'll be able to do?
Well, at least I have a better understanding of like getting the lingual insertion.
Okay.
It definitely. I don't know how to explain it.
Was yours do you think yours handle was 40 degrees? You want it as close as possible. All right. Your face shouldn't be back like that, meaning that it's reflecting at you. The face should be against the actual tooth surface as close as it can be. But if you can see your face, that means that the tooth and the face are not close together. You shouldn't be looking at the face. Face should be looking at the tooth.
Okay.
Everybody with me on that?
Okay.
Same thing for anterior. Face should be against the tooth as close as possible. If it's looking back at you and Mr. Lulu, it's a problem. Okay? We shouldn't see it. It should be adapted. That's adaptation. This here is adaptation. Okay? Same thing for your facial. Handle parallel. Now on the facial side, you will see it, but on that lingual, you shouldn't. And then here, same thing, pivoting in. Don't force it.
So when you're
Pivot
doing
in.
like this tooth, how would you?
On the canine.
Yeah, like how would you get the handle perpendicular? I think that's usually my tricky spot too.
So this tooth is at an angle because it's on the corner. So I would pivot in. Into that particular area. Pivot in. I feel the deposit, get underneath it, lock the toe, angulate, and close it back.
Okay.
Any other questions on the anterior areas?
So when we do the mandibular, it is okay for us to sit behind the patient?
So when you're going
Mhm.
away, so I was just still going away.
Okay.
On both of those, I went away. When you're going towards, you're going to sit over here.
Okay.
Mm-hmm.
I think that was messing me up because I forgot that I was doing.